Okay, welcome everyone. So now we are going to look at the Pick's disease. Pick's disease is frontotemporal dementia. It is progressive dementia characterized by atrophy of frontal and temporal lobes. And the clinical features of the Pick disease is behavior, personality changes, language disturbance, inattentive, compulsive behavior, dementia, and memory-related problems. So the morphology in the pig disease, there will be lobar atrophy and pig bodies will be found in these are weakly basophilic intracytoplasmic incursions, and these are incursion bodies of tau protein, and found same as that and present in the Alzheimer's disease. So now we will be looking at tremors. Tremors are abnormal movement and often caused by disorder in basal ganglia. So there are different types of the tremor like resting tremor, physiological tremor, essential tremor, intentional tremor, and flapping tremor along with other movements. So these all types of tremor present differently in different disorders. Resting tremor occurs in Parkinson disease. These are tremor uh, that are presented at rest and disappear with action. That's why known as resting tremor. Frequency is 4 to 8 Hz, and characteristically pill roll tremors are asymmetrical tremors. Physiological tremors are the tremors most common type of the action tremors. Frequency is 8 to 12. Anxiety occurs in anxiety, thyrotoxicosis, hypoglycemia, and drug abuse like beta agonist, caffeine, and lithium. Okay, so now we are going to look at tremors. There are different types of the tremors in the body. Tremors are abnormal oscillatory movements caused by disorder in basal ganglia. These are rhythmic movements, and the resting tremor, physiological tremor, essential tremor, and intentional tremor, flipping tremors are there in the body. These are different types of the tremors occurs in different diseases. So resting tremors occur in Parkinson disease, and these are present at rest, disappear with action. Frequency of resting tremor is 4 to 8 Hz, and characteristic of resting tremors are pill roll tremor occurs in Parkinson most commonly. Pill roll tremors. Now, physiological tremors are the types of the action tremors whose frequency is 8 to 12 Hz and caused by anxiety, thyrotoxicosis, pheochromocytoma, hypoglycemia, and drug abuse. Other type of tremors are essential tremors. Tremor present both at rest while at intention are known as essential tremor, often inherited. Alcohol suppresses and treatment is beta blocker or propranolol. So these are essential tremors. While other are intentional tremor. Intentional tremor means tremor occurs only with intention, not at rest. These tremors occur at movement, while resting tremors occur at rest. So these both of type of the tremor are opposite to one another. Flapping tremors are also known as hysterexis. These are tremors present with jerking movement of the hand and are present in liver failure, most commonly in CLD, hypercapnia, drug toxicity, and thalamic lesion. Parkinson disease is idiopathic hypokinetic disorder present with sign and symptom of Parkinsonism. It is occurs due to degeneration of neurons in substantia nigra and deficiency of dopamine. And in Parkinson disease, resting tremors, postural tremors, rigidity occurs, and bradykinesia with fascinating gait, postural instability, reduced arm swing, impaired balance, expressionless face, small handwriting micrographia, and uh, feature initially are unilateral, but with time they become bilateral. So in this way, Parkinson disease develops. Morphology of the Parkinson disease is pallor of substantia nigra, loss of pigmented catecholaminergic neurons, and Lewy body incursions. Intraeosinophilic incursions occur. So the treatment of Parkinson disease will be first line agents carbidopa and levodopa, because dopamine is depleted. So carbidopa is given. Non-ergot derivative monoamine oxidase should be given. Wernicke's Korsakoff disease is characterized by deficiency of vitamin B1 thiamine deficiency causes Wernicke's-Korsakoff syndrome, a disease. Now, the causes of this disease is alcoholism, malnutrition, malabsorption, protracted vomiting, or hyperemesis gravidum. So, the clinical features of Wernicke's-Korsakoff disease is acute confusion, stress, Wernicke's encephalopathy, ataxia, nystagmus, extraocular muscle weakness occurs, and Korsakoff syndrome occurs in Wernicke's encephalopathy is inadequate treated, and it present with profound disturbance and a short-term memory associated with the tendency of confabulation. Treatment of Wernicke's-Korsakoff syndrome or disease is thiamine replacement because thiamine is depleted, so thiamine should be given intravenously, oral thiamine, and treat the underlying cause in Wernicke's-Korsakoff disease. So in this way, we can treat this disease and save the life of patient. Okay, so now we are going to start cirrhosis, and cirrhosis is end-stage liver disease characterized by irreversible diffuse fibrosis or regenerative nodules production. Decompensated cirrhosis refers to cirrhosis in associated with jaundice, variceal hemorrhage, ascites,